behalf of ESMO, on behalf of the press committee and the press team, it's my pleasure and an honor to welcome you here in this first and opening press conference of the ESMO 2016 Congress. My name is Solange Peters. I'm working as a medical oncologist in Lausanne, Switzerland, and I will serve as your press officer for this 2016 Copenhagen meeting. My colleagues seated at the table will speak one after the other one about different topics, and at the end of the session we will keep some time for your questions, so please keep and note your questions that will be addressed, as many as possible, at the end of this press conference. The first colleague who will speak after me is Professor Lassen from University of Copenhagen, who will bring you the Danish welcome word to this wonderful city of Copenhagen for this promising meeting. The next speaker will be André Cervantes, your ESMO 2016 scientific chair, who will evoke with you the highlights and the hot topics which will be the most interesting things of this meeting. He will be followed by Dr. Kandolov Tsekulovic, who will share with you the data of a very interesting survey looking at the accessibility of innovative cancer medicines in Europe, and will stress with you the fact that more than 5,000 patients are still denied in Europe the access to the innovative drugs which might change their fate. Professor Tabernero will, based on that, describe and evoke to you how much it is important to have created in ESMO an ESMO Cancer Medicines Working Group in order to address the question of quality of care and access to innovation. And to close this press conference, of course, our ESMO president, Professor Ciardello, will bring you all the important key messages from the ESMO as a membership-based organization. The tagline of this year's meeting is "From disease treatment to patient care." This tagline is very important because for us it stresses the fact that first of all, and more importantly than anything, ESMO cares for patients and strives to make innovations available and accessible to a majority of patients in Europe. The reason is that cancer has overtaken cardiovascular diseases as #1 killer in 12 of our European countries. And I don't want to go into the details of numbers, but I like this slide because it's just a projection in the next 5 years about the mortality across diseases and across genders related to cancer. And to make a long story short, it's very important to look at the fact that the deaths related to cancer will still increase in the next 5 years in Europe and worldwide, and importantly in the world, the female death mortality from cancer will be superior to the male cancer deaths in the world, which is very important because it also teaches us some things about epidemiology of cancer. And just to show the usual slide about the more deadly disease we are trying to treat on a daily basis, still lung cancer, colorectal and breast cancer are the major causes of cancer deaths worldwide and in Europe. What is the answer? For ESMO, the answer is basically the research and the clinical research. We have here groundbreaking and practice-changing research which will be presented to you during this meeting in lung cancer, in melanoma, ovarian cancer, breast cancer, head and neck cancer. And we hope that we can create here and offer good tools for physicians and bring good news for patients. We will present the data today, and thanks to your help, we hope it will help joining the community and will join the clinic and daily practice tomorrow. I think the Congress of ESMO 2016 Copenhagen fits the scenario because there are even 20,000 delegates today from over 130 countries and nearly 300 journalists accredited, because it's very important that the good news can reach every doctor and can reach every patient. And I thank you for being here because this is what you will be able to contribute for all the community to bring this news to them. We have been making a quite, I would say, intensive program for you, 5 press conferences, 31 press releases, You will have experts in the room at every single press conference able to answer your question, and you will also have a Meet the President session that will take place on Sunday morning. Please come and join, ask questions, make discussion with the President. Very importantly, we have a question and answer session at the end of this press conference. Please try to keep your questions in the time frame which is planned, because all of us will have to run to the opening ceremony and its preparation. So we won't have time beyond the question forum today, but please also take the opportunity, if you need to speak to any of us, to go to the press office and to ask for an appointment. We will arrange it for you and make it feasible if it's important. But please, lots of questions at the end will be the solution. At ESMO 2016, we will use the modern ways of communication too. So on Twitter, with the hashtag ESMO16, you will be able to communicate. We have our newspapers, the Daily Reporter, which will come out every day. And we have 3 releases, 3 editions every day of our broadcast, which I'm sure will be very exciting. You see here the program of the press conferences, Saturday, Sunday, Monday in the morning. And the opening today and the closing on Tuesday. We are very happy to meet you there. To make a very short summary, the first press conference will be about targeted therapy in ovarian and breast cancer, as well as adjuvant treatment in melanoma, with the related experts, of course. The second press conference will be dedicated to lung cancer, which will be probably one of the very interesting topics in this meeting. And the third press conference will be about genital urinary cancers, as well as sarcoma, with, again, the experts in the field. I told you about the press releases. 21 of these press releases are dealing with late-breaking research, which is late-breaking news too for the community, but there are also 10 press releases on other very important topics for the community and society: cancer screening, supportive and palliative care, adherence to therapy, access to cancer care, gender balance or gender bias in oncology, which is to me a very important subject. And I invite you passing by to the session Sunday night from 9 to 10:30, the session of Women for Oncology, stating about the women still representing a minority in leadership positions and trying to find a way to change the picture in the future. I just need to remind you about the embargo policy rules. The poster discussions and profit paper, the embargo was already lifted. Regarding the late-breaking abstract, the embargo is lifted every day, the day of the presentation at 8:15. Of course, you have all the documents, but please remember these rules. And the abstract selected for the official ESMO press program, the embargo lifts at the beginning of the related official press conference at 8:15 too. Please remember these rules, and please, beyond this press conference, at any time, if you need some help, if you need to meet any of the experts, investigator, ESMO spokesperson, just go to our dream team, the press team, in order to find abstract, find people, and arrange the way for you to do your job optimally. And with this, I'm very happy to welcome my colleague, Professor Lasson, for the next talk. Thank you.
Thank you very much, and I'm happy to be here. Happy that